I'm doing breast augmentation, do I go above the muscle or behind the muscle? And it really depends on the anatomy of the patient, the wishes of the patient. And then once I evaluate them, I'll give them my recommendations. Generally, for most patients, I do go behind the muscle. So it's called a dual plane 1 technique, where it's primarily behind the muscle, and there's a small release of the muscle done along the cleavage area and right at the very bottom, so they can get better cleavage. And this is how I treat most of my patients, because I do believe that it does reduce capsular contracture rates and has a very long-term good effect. But there's some patients where I do want to go above the muscle, and these are patients who maybe have a very wide chest and they want a closer cleavage, or they have a very short nipple to inframammary fold distance, or they are in fit competitions where they have very low body fat, and then they're holding their positions with when they have really good muscle development to show off their muscles. So in those patients, sometimes going above the muscle is more beneficial. So in those patients, when you go above the muscle, they do have a slightly higher risk of capsular contracture. That means scar tissue developing on the implant. So now I think where I'm really, really excited is, so these are more of our implants that I normally use for behind the muscle. And we have 3 great companies in the US that produce these, and I've been very, very satisfied with them. So the newer implant is a Motiva implant. I think this may be, from what I've heard from the European literature and the very recent American literature and studies, is that there's decreased capsular contracture when these are placed above the muscle. So I think certainly preferentially, if I were to treat a patient by placing implants above the muscle, I think the Motiva would be my number 1 choice before I chose the other smooth implants.